Now, as I mentioned, it's important gathering today, I think, that we take a step back and think about how far we've come as a country. When the President tapped me to lead the White House Coronavirus Task Force, he said we had one mission, and that was to save lives. Our best scientists believe that we could reduce the number of American fatalities to a number ranging between 100,000 and 240,000. The President made that decision, and we unveiled the 15 days that became the 45 days to slow the spread. And inarguably, as we see where we are today as a nation, because of what the American people have done, because of the incredible work of our healthcare workers, because of a partnership with governors in every state, we did just that. We slowed the spread. We flattened the curve. We saved lives. But our focus today is very much on the advent of a rising series of new cases across the American South. As you may recall, after seeing overall cases drop from a 30,000 a day average in April to 25,000 a day of average in May, the first few weeks of June actually saw cases averaging roughly 20,000 new cases a day. We now have seen cases begin to rise precipitously across the South. One of the things that we're seeing among the cases, and we hear this in Florida, and we hear this in Texas and elsewhere, is that roughly half of the new cases are Americans under the age of 35, which is at a certain level very encouraging news, as the experts tell us, because as we know so far in this pandemic, that younger Americans are less susceptible to serious outcomes of the coronavirus. And the fact that we are finding more younger Americans who've contracted the coronavirus is a good thing. And so we stand here today, we believe we've made progress. But as we are reminded as we see cases rising across the South, that we still have work to do. And so we say to every American, particularly those in counties and in states that are being impacted by rising cases, that now's the time for everybody to continue to do their part.